Do you ever find yourself staring at a bottle of prescribed medication and a wave of anxiety washes over you? If so, you're not alone. Many people experience intense worry or fear at the thought of taking a new medication, a fear that can stem from various deep-seated concerns. Matt had been prescribed a medication to help with his intrusive thoughts and anxiety several years ago. Now, at that time, he took the medication as prescribed and he felt great with no noticeable side effects, and his anxiety and his OCD was more manageable. However, Matt had listened to a few different programs and he had developed a distrust of medications and the pharmaceutical industry. Now, he abruptly decided to stop taking his medication. And that decision snowballed into this horrible recurrence of anxiety, insomnia, and intrusive thoughts that caused him to leave his job, lose his relationship, and he had a major mental health crisis. I could sympathize with Matt. He didn't foresee those consequences, and he tried so hard for months to recover without the use of medication. And he experienced panic and anxiety just thinking about retaking it. Now today, we're diving into understanding this fear and taking medication and exploring ways to understand it and navigate through it. Now, it's natural to have a mix of emotions when receiving a new prescription. You might wonder if you really need it, if there will be side effects, what to do about those side effects if you experience them. You might wonder if the medication causes dependence, if it interacts with something else you're taking, if it could cause you permanent damage. Now, those questions are all reasonable and they should all be explored. The fear of taking medication, or it's called pharmacophobia, is common. A study in health psychology research in 2020 by Anna Petlensik and colleagues now estimated that there's 30 to 50% of the population does not adhere to their prescribed medications. And one of the main reasons why is pharmacophobia, the fear of medication and having a negative attitude about medications, pharmaceuticals, and the medical profession in general. Now, the fear can manifest as anything from mild apprehension to severe anxiety and panic, leading to this avoidance of crucial medications. But what drives this fear? So let's break it down. For some, past negative experiences or traumas or a general distrust of the pharmaceutical industry can cultivate a fear that taking medication might lead to adverse side effects or dependence. Now, others might fear the physical act of swallowing a pill. They might worry about choking. And this condition is known as pseudodysphagia. Then there are those who experience obsessive compulsive disorder and health anxiety, particularly with the side effects and the what-if worries of taking their medications. Now, most of the people enrolled in my health anxiety recovery program do have a fear of taking medications. People with health anxiety tend to experience more side effects than people without health anxiety. There is something called Nocebo effect, and it's the opposite of something you may be familiar with, placebo effect. Now, a placebo effect is when a person has a positive result taking a medication that's produced from having a belief that the medication will be effective, even though the medication had no real effect. Now, doctors used to prescribe sugar pills to patients not too long ago, just to give their patients the benefit of having a placebo effect. Placebos work in at least a third of patients and sometimes up to 60% because the mind is very powerful. Now, a nocebo effect is when a person expects a negative side effect from a medication, and this can lead them to experience what they anticipate experiencing. So if you tend to imagine the worst case scenarios when taking a medication, you have to wonder if the fear or the anxiety created by taking a medication creates the feared side effect, and whether taking a medication is more stressful than not taking it. And finally, skepticism towards medication and the healthcare system, especially around mental health medication, also contributes to pharmacophobia. It's interesting that a major predictor of whether someone develops a fear of taking a medication is their tendency to believe in conspiracy theories. So one thing I learned by researching this topic is that if I need a medication and I want that medication to work, I'm going to need to believe that that medication can work. So how do you move beyond this fear? Now remember that feeling anxious about taking a medication is common, and it's nothing at all to feel ashamed about. Here are some actionable steps to help you. Start by addressing your fears openly with your doctor or your therapist, creating a plan that feels manageable for you. If your fear is rooted in OCD or anxiety disorders, exposure and response prevention, ERP therapy, has shown significant efficacy. Now, ERP involves gradually exposing yourself to your fear in a controlled manner, helping you to build up your tolerance and reduce avoidance behaviors. Now, cognitive behavior therapy, CBT, can also help you in becoming more aware of your thoughts and your interpretations and be less rigid in your thinking patterns related to medication. Now, if swallowing pills is the issue, exploring alternative medication forms like liquids or dissolvable tablets can help. And also consider keeping a journal of your experiences and your feelings as you navigate your fears, noting any progress or setbacks. Consider your overall quality of life when making a plan and be willing to be flexible if whatever choice you make is not working for you. You cannot get so rigid in your decision that you end up harming yourself and reducing your quality of life because of your fear. So if you're looking for an understanding support group, I want to welcome you to join the WarmHeart Club. It's a support community for people with anxiety disorders and OCD, and you can find it at PaigePradko.com. Now, as a therapist, I believe that taking a medication is a personal choice. And whether you take medication or not, please consider your overall quality of life when making that decision. I support clients in their decisions either way. Matt didn't want to take medication, and I honored and I respected his choice. And together we worked to help him improve his mood and anxiety first without medication. And in his case, it just wasn't enough. He was still plagued by intrusive thoughts and relentless anxiety. And in the end, Matt decided that to improve the quality of his life, he needed to go back on his medication. Matt's anxiety associated with taking the medication slowly diminished as he faced his fears and took his daily medication. Remember, you're not alone. If you need support, I have resources to help you at PaigePradko.com. Until next time, I'll see you in session. Take care. Bye-bye.